Hello everyone, and welcome to my channel, Health for Life. Today I'm going to talk about alcohol use disorder, or AUD. A chronic brain disease that affects millions of people around the world. Alcohol use disorder is characterized by uncontrolled dependence on alcohol, which can cause serious physical, psychological, and social problems. In this video, I will cover overview, symptoms, causes, risk factors, complications, prevention, diagnosis, and treatment of alcohol use disorder. Let's start with an overview of alcohol use disorder. Alcohol use disorder is a pattern of alcohol use that involves problems controlling your drinking, being preoccupied with alcohol, or continuing to use alcohol even when it causes harm. Alcohol use disorder can range from mild to severe, depending on the number of symptoms you experience. Alcohol use disorder is not the same as binge drinking, which is a pattern of drinking where you consume a large amount of alcohol in a short period of time. Binge drinking can also be harmful, but it does not necessarily indicate alcohol use disorder. Alcohol use disorder is a brain disease, meaning that alcohol changes the way your brain works and affects your mood, behavior, and cognition. Alcohol use disorder develops gradually over time as you drink more alcohol and become more tolerant to its effects. Alcohol use disorder can also cause withdrawal symptoms, such as nausea, sweating, and shaking, when you stop or reduce your drinking. So, how do you know if you have alcohol use disorder or if someone you care about has it? There are some common signs and symptoms that can indicate alcohol use disorder, such as being unable to limit the amount of alcohol you drink, or making unsuccessful attempts to cut down, spending a lot of time drinking, getting alcohol, or recovering from its effects, feeling a strong craving or urge to drink alcohol, failing to fulfill your obligations at work, school, or at home due to your drinking, continuing to drink alcohol, even though you know it's causing physical, social, or interpersonal problems, giving up or reducing your hobbies, activities, or social life because of your drinking, using alcohol in situations where it's not safe, such as when driving, swimming, or operating machinery. Developing a tolerance to alcohol, meaning that you need more to feel its effect or that you have a reduced effect from the same amount. Experiencing withdrawal symptoms when you don't drink, or when you drink less than usual. If you have any of these symptoms, you may have alcohol use disorder and you should consider seeking help. The more symptoms you have, the more severe your alcohol use disorder is likely to be.
But what causes alcohol use disorder in the first place? There is no single cause of alcohol use disorder, but rather a combination of genetic, environmental, and psychological factors that influence your vulnerability to alcohol addiction. Some of the factors that can contribute to alcohol use disorder are having a family history of alcohol use disorder or other substance use disorders, starting to drink at an early age, or having a history of childhood trauma or abuse, having a mental health condition, such as depression, anxiety, bipolar disorder, or post-traumatic stress disorder, experiencing stress, loneliness, boredom, or peer pressure, living in a culture or environment where alcohol is easily available, acceptable, or encouraged. These factors do not necessarily cause alcohol use disorder, but they can increase your risk of developing it. On the other hand, some factors can protect you from alcohol use disorder, such as having a strong support system, a sense of purpose, a healthy lifestyle, and coping skills. However, even if you have some protective factors, alcohol use disorder can still have serious complications for your health and well-being. Some of the potential consequences of alcohol use disorder are liver damage, such as cirrhosis, hepatitis, or liver cancer, heart problems, such as high blood pressure, irregular heartbeat, or heart failure, brain damage, such as memory loss, cognitive impairment, or dementia, pancreas damage, such as pancreatitis, or diabetes, cancer, such as mouth, throat, esophagus, stomach, colon, or breast cancer, immune system impairment, such as increased susceptibility to infections or diseases, mental health problems, such as depression, anxiety, psychosis, or suicide, social problems, such as isolation, relationship conflicts, domestic violence, or legal troubles, accidents, injuries, or death, such as from falls, car crashes, drowning, or overdose. These complications can be life-threatening and irreversible, so it's important to prevent alcohol use disorder or seek treatment as soon as possible. But how can you prevent alcohol use disorder or reduce your risk of developing it? There are some simple steps that you can take to avoid or limit your alcohol use, such as setting a limit on how much and how often you drink and sticking to it, keeping track of your drinking habits and being honest with yourself and others about them, avoiding situations or people that trigger or pressure you to drink, finding healthy alternatives to drinking, such as hobbies, exercise, meditation, or socializing, seeking help if you have a mental health condition or a stressful life event that makes you want to drink, talking to your doctor if you have a family history of alcohol use disorder or other risk factors, educating yourself and others about the harms of alcohol and the benefits of moderation. These steps can help you prevent alcohol use disorder or reduce your risk of developing it. But they may not be enough if you already have alcohol use disorder. If you have alcohol use disorder, you should seek professional help as soon as possible, because alcohol use disorder is a serious and chronic disease that requires medical attention and support. So, when should you see a doctor for alcohol use disorder? You should see a doctor for alcohol use disorder if you have any of the signs or symptoms of alcohol use disorder that I mentioned earlier. Want to quit or reduce your drinking, but find it hard to do so. Experience withdrawal symptoms when you stop or cut back on your drinking. Have any of the complications of alcohol use disorder that I mentioned earlier. Have any other health problems that may be related to or worsened by your drinking. Have any questions or concerns about your alcohol use or its effects. Your doctor can help you diagnose alcohol use disorder and recommend the best treatment options for you. Your doctor can also refer you to other specialists or resources that can help you with your recovery. But how is alcohol use disorder diagnosed and what tests are involved? Alcohol use disorder is diagnosed based on your symptoms, your drinking history, and your physical and mental health. Your doctor will ask you questions about your alcohol use, such as, how much and how often do you drink? How long have you been drinking? Do you have trouble controlling or stopping your drinking? Do you have cravings or urges to drink? Do you drink more than you intend to or more than you used to? Do you drink in situations where it's not safe or appropriate? Do you drink despite knowing the negative consequences of your drinking? Do you experience withdrawal symptoms when you don't drink or when you drink less? Your doctor will also ask you about your health, your family, your work, your relationships, and your mood. Your doctor will use a standardized questionnaire or a diagnostic manual to assess your symptoms and determine if you have alcohol use disorder and how severe it is. Your doctor may also perform a physical examination and order some blood tests to check your liver function, blood count, and other indicators of your health. Your doctor may also screen you for other substance use disorders or mental health conditions that may co-occur with alcohol use disorder. Based on your diagnosis, your doctor will suggest the most appropriate treatment options for you. Treatment for alcohol use disorder can involve medication, counseling, and behavioral therapy, or a combination of these approaches. The goal of treatment is to help you stop or reduce your drinking, prevent or manage the complications of alcohol use disorder, and improve your quality of life. Now, let's talk further about the available treatment options for alcohol use disorder and how they work. There are different types of treatment options for alcohol use disorder, depending on your needs and preferences. Some of the common treatment options are medication. There are some medications that can help you with alcohol use disorder, such as naltrexone. This medication blocks the effects of alcohol on your brain, reducing your cravings and your pleasure from drinking. It can help you drink less or quit altogether. Acamprosate. This medication helps restore the balance of chemicals in your brain that are disrupted by alcohol. It can help you cope with the withdrawal symptoms and reduce your relapse risk. Disulfiram. This medication interferes with the metabolism of alcohol, causing unpleasant reactions such as nausea, vomiting, headache, and flushing if you drink while taking it. It can help you avoid drinking by creating a negative association with alcohol. Other medications. Your doctor may also prescribe you other medications to treat the complications of alcohol use disorder, such as antidepressants, anticonvulsants, or painkillers. These medications can help you manage your physical and mental health problems that may be caused by or worsened by your drinking. Counseling is a type of talk therapy that involves working with a trained professional, such as a psychologist, a psychiatrist, a social worker, or a counselor, to address the underlying issues that contribute to your alcohol use disorder. Counseling can help you understand the causes and consequences of your alcohol use disorder. Identify and change your negative thoughts, feelings, and behaviors related to alcohol. Develop coping skills and strategies to deal with stress, triggers, and cravings. Set realistic and achievable goals and monitor your progress. Build your self-esteem and confidence. Improve your relationships and communication skills. Find support and motivation from others who have similar experiences. Behavioral therapy is a type of counseling that focuses on changing your behavior and habits related to alcohol. Behavioral therapy can help you learn to recognize and avoid situations that tempt you to drink. Learn to replace drinking with healthier and more rewarding activities. Learn to reward yourself for positive changes and actions. Learn to manage your emotions and impulses without relying on alcohol. Learn to cope with relapse and prevent it from happening again. Some of the common types of behavioral therapy are cognitive behavioral therapy (CBT). CBT helps you identify and challenge your distorted thoughts and beliefs that lead you to drink and replace them with more realistic and positive ones. Motivational enhancement therapy MET helps you increase your motivation and commitment to change your drinking behavior by exploring the pros and cons of your alcohol use and the benefits of quitting or reducing it. Contingency management CM helps you reinforce your positive behavior and outcomes by providing you with tangible rewards, such as vouchers, prizes, or money for staying sober or meeting your goals. Family therapy helps you involve your family members or significant others in your treatment and recovery process. Group therapy helps you connect with other people who have alcohol use disorder or are in recovery and share your experiences, challenges, and successes with them in a safe and supportive environment. These are some of the common treatment options for alcohol use disorder, but they are not the only ones. There are also other types of treatment that may suit your needs and preferences, such as detoxification. Detoxification is the process of safely removing alcohol from your body and managing the withdrawal symptoms that may occur. Detoxification can be done at home, in a hospital, or in a specialized facility, depending on the severity of your alcohol use disorder and the level of medical supervision you need. Detoxification is usually the first step of treatment, but it is not enough by itself. You also need to follow up with other forms of treatment to prevent relapse and address the root causes of your alcohol use disorder. Residential or inpatient treatment. It is a type of treatment where you stay in a facility for a period of time, usually from a few days to a few months, and receive intensive and comprehensive care for your alcohol use disorder and any co-occurring conditions. Residential or inpatient treatment can provide you with a structured and supportive environment where you can focus on your recovery and receive 24/7 medical and psychological assistance. Residential or inpatient treatment can be beneficial for people who have severe alcohol use disorder, who have other medical or mental health problems, who have a history of relapse, or who lack a stable or supportive home environment. Outpatient treatment. It is a type of treatment where you visit a clinic, a hospital, or a counselor's office for a few hours a week and receive care for your alcohol use disorder and any co-occurring conditions. Outpatient treatment can provide you with flexibility and convenience, as you can continue with your normal activities, such as work, school, or family, while receiving treatment. Outpatient treatment can be beneficial for people who have mild to moderate alcohol use disorder, who have a strong support system, who have a high level of motivation, or who have completed a residential or inpatient treatment program. Recovery support services are services that help you maintain your sobriety and enhance your quality of life after you complete your treatment. Recovery support services can include self-help groups. Self-help groups are groups of people who have alcohol use disorder or are in recovery, and who meet regularly to share their experiences, offer support, and provide guidance to each other. Some of the common self-help groups are Alcoholics Anonymous AA, Smart Recovery, Women for Sobriety, and secular organizations for sobriety. Peer recovery coaches are people who have alcohol use disorder or are in recovery, and who provide you with one-on-one or group support, mentoring, and advocacy. Peer recovery coaches can help you navigate the recovery process, access resources, overcome barriers, and achieve your goals. These are some of the common recovery support services, but they are not the only ones. There are also other types of recovery support services that may suit your needs and preferences, such as online forums, apps, hotlines, or faith-based programs. As you can see, there are many treatment options and recovery support services. available for alcohol use disorder, and there is no one-size-fits-all solution. The best treatment option for you depends on your individual situation, needs, and goals. You may need to try different types of treatment or combine them to find what works best for you. The most important thing is to seek help as soon as possible and to stick with it. Treatment for alcohol use disorder can be challenging, but it can also be rewarding and life-changing. You are not alone in this journey, and you can recover from alcohol use disorder and live a healthy and fulfilling life. Thank you for watching this video. I hope you found it informative and helpful. If you have any questions or comments, please leave them below. If you like this video, please give it a thumbs up and subscribe to my channel for more videos on health and wellness topics. Also remember to always consult your doctor for medical advice.